Okay, everybody, we're going to go ahead and get started. I think Amy's got some housekeeping information for us as we start to launch today's meeting. I know we've got some attendees still coming on.
Yeah, so I will get started as people are joining. Thank you everyone for registering for our very first Stakeholder Sharing Session, Community Outreach and Education. So before we jump into it, I wanted to go over just some ground rules for our session today. So currently, most of you are on the session today as participants. However, once I am done talking, I'm going to be switching everyone over to panelist. That way we can all see each other and all hear each other. Please note once we get started though, if we are hearing background noise, we will be muting people just so everyone can hear whoever is speaking. However, you can unmute yourself at any time. So if you look at the bottom left-hand corner of the meeting window, there will be an unmute button. It is shaped like a little microphone. Or if you want to temporarily unmute, you can press and hold your spacebar on your keyboard. So once we switch you over, you will also have the option to enable the gallery view, so that you can see the most people on your screen. And to do this, you'll just be clicking in the upper right-hand corner of your Zoom window. If it's not there for you, or if you're having any other issues, you can always reference the Zoom guidelines that were included in the email confirmation and also the reminders that were sent. So as hopefully you've already seen if you're joined by computer, we'll be using the chat box to introduce ourselves. So if you haven't already, please type in your name and your organization. Another great way for us to make sure we know who's here is by renaming yourself. So you can do that by right-clicking on where your video is displayed and clicking rename from there. You can also go to where your video is displayed, and in the upper right-hand corner, if you hover, 3 little dots should appear. You can click on that and go to rename from there. So lastly, just a reminder for everyone, including PCOH staff, we're going to try to keep our conversation as relevant as possible to the session topic. All of the PCOH staff is here and ready to participate, along with our intern as well. So with that, I will pass it off to Helen.
Okay, so Helen Hockey here, everybody. Thank you so much for joining us, and Amy's going to start bringing everybody in so that we have the wonderful Brady Bunch view, something that if you haven't used Zoom, I feel like we're all proficient at Zoom at this point, but if you haven't used Zoom, there should be an option in the upper right-hand corner of your screen if you're looking using a computer or desktop or laptop, to go to gallery view rather than speaker view, and that'll give you the nice pretty squares where you can see everybody, and it's a little bit easier to have kind of conversation that way. So the other thing I did want to just mention, I know everyone's introducing themselves in the chat. There are a handful of people who have called in on the phone. More than likely those individuals are probably joined by video as well. But if you want to, as you're able to unmute yourself and join in the conversation, please do feel free to introduce yourself if you haven't been able to type that into the chat as we move forward. And I think Amy's bringing everybody on now. I'm going to bring up my little grid view so I can see. And let's see here. Okay, so this is our first session that we're doing in terms of a stakeholder sharing session, and just a little bit of background. We really wanted to figure out a way that we could have the same level or at least close to the same level of conversation that we typically have at our in-person meetings. via internet. In our new world. So this was an idea where, you know, we didn't want to make this all about presentation only. We didn't want to make this a situation where we were just lecturing. We really wanted people to be able to chat and talk with each other, share ideas. So we do have, we're going to give a quick 5-minute update. If you know me well, we're hoping for 5 minutes, maybe a little bit longer, on some of the work that PCOH is doing around community outreach and education this year. But then I really want to turn it over to everyone that's here. We've kind of asked a handful of people to share first, just to kind of get the conversation rolling. But that being said, we want everyone to feel free to share. So I think that was my laundry list of things. So looking at and everyone should be able to see the slides here. Once I go through these first couple slides, we'll shut the slides down, and then I'll actually make it easier for everyone to see each other on the screen. But I do really well with slides. So for those who may be joining PCOH for one of our stakeholder meetings for the first time, or maybe you've just heard about us through the grapevine, but you may not be as familiar with the work that we do, just a quick little reminder slide that, you know, lets everybody know that we really work as the State Oral Health Coalition, in that we try to convene and connect like-minded individuals. So anybody who really is interested in improving oral health for Pennsylvanians, you're our kind of people, and we want you. So we have nearly 1,000 individuals and organizations from across the state that work as part of our coalition. We're not a membership organization, so we don't charge anything to be a part of the fund. But you know, we do try to work with as many groups as we can. So there's some information here. One of the other things we like to mention is that we do work very closely with the State Department of Health. So we make sure that we help them implement the programs that they're doing on a state level basis. And we are a nonprofit, so we have a small staff and rely heavily on grants and private and corporate foundations to sustain our work. So that's all about us. I listed our 4 priorities here. Basically, we focus on workforce, which is bigger than just dentists, hygienists, dental staff. You know, we look at other kind of oral health workforces as well. So, you know, we look at community health workers, we look at pediatricians. A lot of different people make up an oral health workforce. So we focus on a lot of those programs. We look at community water fluoridation levels, and we advocate for increased levels in our state. We focus a lot on what we would consider our most vulnerable populations. So, you know, groups that have been sort of just historically underserved really are kind of the ones we want to elevate up in a more kind of health equitable way. And then, of course, lastly, as a coalition, a lot of our job goes into the advocacy we do, both at a state level and locally, to incorporate oral health into policy pretty much everywhere. So, you know, if you give me a subject, I will tell you how we can get oral health into it. That's just sort of what we do. And if you're new to us and you want to learn all about our history and everything we've done, check out our YouTube channel, and you'll be able to see recordings of all of our past meetings and presentations that will kind of give you some background. Okay, so my quick, and it's really only one slide, quick update around what we are doing for community outreach and education this year. And I will probably skim over a little bit of this just because I know some of you on the call are probably able to better speak to it than I would be. So as I mentioned, so when we talk community outreach and education, some of that takes place from and within a dental office. Some of that takes place in educational facilities. Some of that takes place in you know, schools. So we're talking about a variety of different locations, but again, speaking more towards oral health. That's really going to be our focus. And so a couple different projects in no order that I just want to sort of talk about. We started in 2018 a charitable work tracking project, which primarily focuses on identifying the ways that community clinics, free clinics, pop-up clinics all serve the public who need dental help. So, we keep track of all the free and charitable dental work that happens, which can include education. So it's not just simply clinical care. And we will be finalizing our survey that will collect 2019 data over the next month or so. And we're hoping to get those surveys out very quickly. The other piece, many of you who have worked with PCOH in the past know that we are closely tied to the state oral health program and the state oral health plan. We are in the process of finalizing the next iteration of the state oral health plan, which will run from 2020 to 2030. It actually starts July 1st, so we're not late. I always have to say that, because if I say 2020, people say it's May. We're not late. It doesn't officially start till July 1. So we'll see. We still might be a little late, but our goal is to have a nice 10-year plan out for review sometime this summer that will focus, and many of you who were involved last year in our discussions around this know that a lot of the discussion in the plan is focusing on access and prevention and education. So, seeing ways that we can reach the community, not just from a clinical perspective. As part of our work with with the oral health program, we help them issue mini grants to community members who are doing different programs. So if you're doing something around access, prevention, education in your community, you may be eligible to apply for one of these small mini grants, which can help some of the projects that kind of operate on a local and regional level. I did want to mention one of the projects that's funded through our state HRSA grant, which is a teledentistry project. Not so much from the clinical side of things, but we've been doing this. We're in the end of year 2 for this project right now, working with the local Head Start up in Erie County and the Erie County Department of Health and their public health dental hygiene practitioner. So it's a connection from that PHDHP who can go into the Head Start and then connect those children with a dental home through teledentistry. So it's a really amazing project, and we're looking forward to sharing sort of the data that comes out of it in the coming months. We just issued, again, community outreach wise and talking, of course we have to mention COVID-19. It's probably, that's where we don't want to see things, get too crazy around COVID, but we did just adapt a document that was put forth by Oral Health Kansas regarding sort of information to share with patients and the general public, what they should expect from a dental office, during and post COVID-19. So that's something that if you work with community groups or you have, navigators in your centers or anybody who's really kind of working one-on-one with the general public, we would encourage you to share that document with them if it's helpful, so that everyone sort of knows what to expect. It is available on our website, paoralhealth.org/COVID-19. And kind of going along with that is we've been doing a lot of talk recently about what can we do during this pandemic to help families and community members who may not have access to a dental home at this time. So, we're talking, and I know we have some managed care organizations on the call. I know we have providers on the call. We're talking about ways that we can get these kinds of services funded, so that, if a parent can't bring their 2-year-old into the dental office, then we may need to tell the parent some tips and tricks for home. So, talking about ways to talk to those families, give that information out, and then, advocating for reimbursement for those services that can be provided via teledentistry. For adults, we're looking at, and I know we're going to hear a little more about tobacco cessation counseling, so I'm not going to get into that, but it is a focus for adults, as well as for those patients who are high risk for things like oral cancer lesions. We want to make sure that we're promoting things like self-checks and teaching people how to do self-checks, because right now, getting a quick appointment to get something looked at is not so easy to do. And lastly, the one focus area, I'm sure we're going to talk a little bit about schools, so I'm not going to get too much into that. But I did want to briefly mention the community health worker certification in Pennsylvania. For those who aren't aware, community health workers kind of serve as a navigator between the community and health resources. So we've been working sort of on different programs around that for the last few years. And this year was the first year that the PA Certification Board is now certifying community health workers. So 2020 is a grandfather period where community health workers can complete so many hours of education, so many hours of preceptorship, and be awarded a certification through the PA Certification Board. So we are in process in submitting a request that oral health be a required part of that curriculum, so that any program in the state that wants to offer community health worker training would then have to have so many hours of oral health as part of that curriculum. So it's really, really important to us to see that because these are individuals that work with communities directly. And, you know, we've already sort of seen some reaches into home visitors and nurse family partnerships. But now as we utilize the community health worker more and more, I think it's really important that we bring that up. So with that, I promised you, I told you it would be really short, but I'm just flashing this slide up so that if you guys, as we start the conversation here, if you guys enjoy the conversation and you want to learn more about any of the subjects on the screen, I believe in all but one, we've got some space available still to register for any of the other sessions. So, you know, if today is a good conversation for you and you want to learn more about one of the other topics, check out they're listed on our website, they're listed in our newsletter. And again, I think most of you that I can recall off the top of my head are subscribed to our newsletter, but there is a link to subscribe to our newsletter on our website as well, which we tend to share a lot of information using our newsletter. It's a quick little blurb that we send out about once a week that just gives sort of like the 3 or 4 top things you need to know for the week. You know, it's not a real lengthy or heavy reading kind of newsletter. So with that, I'm actually going to stop talking and I'm going to, as I mentioned, we had a handful of people that we know wanted to share some updates quickly. And so I'm going to go ahead and call on Kristen to be next if she's available. And then once everyone sort of has some time to share, then, you know, feel free, of course, to ask questions. Take yourself off of mute. We'll only mute you if we hear a ton of background noise, I promise. If it's quiet at your house, you can leave yourself off of mute because we do want, and I know Kristen even would definitely want to have questions asked after she has some time to talk through. So thank you.
Certainly. All right, hi everybody. My name is Kristen Hegley-Hill and I am the Program Director for Healthy Teeth, Healthy Children, which is a program of the Pennsylvania chapter of the American Academy of Pediatrics. I see a lot of familiar faces and familiar names, so hello, it's nice to see you guys again. I'm gonna quickly share my screen. I think I should be able to do that. Is it letting me? Aha. I also enjoy using PowerPoints to ground myself when I'm speaking. So there we go. Everybody can see it says Healthy Teeth, Healthy Children on the screen now. I'm gonna say thumbs up. Helen, you're my guide right now. Okay. So like I said, I work with Healthy Teeth, Healthy Children, and organization is focused on improving oral health care for children through 3 primary strategies. The first is providing education of primary care providers. That's kind of the bread and butter. We were founded on a base of educating physicians on the importance of including oral health in overall healthcare for children and families. The second component, which is what I'm going to be speaking about today, is expanding oral health literacy for the community. And then we also participate in a number of integrative partnerships with folks such as PCOH to improve oral health care for all Pennsylvanians. So I wanted to talk today and focus a little bit about our Oral Health Story Kit project, which has been a really exciting project for me. So a little background about myself. I've been now, I can't believe it, I've been working for Healthy Teeth now for 5 years. But I came into this from a background in education, working for education nonprofits and a literacy nonprofit to boot. And so when I took this job, I was really excited about the community outreach and education part because I felt like I had the most connection to that in the work that I had done. But I came on board and was like, okay, so what are we doing to work with community members? Do we have any partnerships with libraries? And got a lot of blank stares and was kind of taken aback by that. And that's where this whole thing kind of came from. This idea I had that, you know, we create such great materials for medical providers. And there's things that we ask them, you know, we have for them to turn around and put up in offices and things. But I wanted to try and figure out different ways to reach out to community members to get that same information. I think that oral health education needs to come from all different stakeholders and all different people. So thus the Oral Health Story Kit project was born. So I reached out first to work with public libraries, but this tool has now been adapted for public libraries, for home visitors, and we are in the middle of adaptation for early learning providers. So it's been a really exciting project, creating some tangible tools, and it's an integrative process. So I don't believe in making things for people without them. And I think that's been kind of the key to our success is engaging groups in the development process along the way. So this is the process that's kind of come out of this, this project. It's a 5-step process. We spend the most amount of time in the development and refinement. And I've just kind of given a quick bullet that the keys here about engaging experts. And in all of the iterations of this project, I've created advisory groups to establish that there is that need to investigate if it's feasible to create something, and then set project goals that are very specific and achievable so that we are not getting too lofty in what we're looking to create. We've always had a development of a prototype kind of process with that advisory group. And then we've done at least one pilot project. I personally prefer to do 2 pilots. I think a small pilot to start with like a one-on-one, that's worked well with our libraries, with our home visitor kits. We did it with one nurse family partnerships agency to get that direct user feedback. And then I like to go then to a second pilot that's an expanded pilot that really then focuses on the logistics of distribution. Something that I've learned from something like this is that the distribution of this amount of materials can be very challenging, and you really need stakeholder buy-in and strategies that make sense for the stakeholders, because you don't want to create something that they can't get, and you don't want to create something that they won't use. And then launching, piloting and taking the pilot feedbacks, making the finalized materials, and then launching in partnership with stakeholders has also been, I think, a really important key. We've done a lot working with the actual events. I know in a post-COVID world, there might not be so many in-person events, but it's been a really successful way to reach out to those stakeholder groups and get people excited about the tools coming. So that helps with engagement and actual implementation. Like I said, distribution key is to, I think, be connected to those stakeholders. With the library project, we worked very closely with the district directors. So instead of having to worry about navigating distribution to every individual library across the state, we were able to focus just on the districts and to send the materials actually unassembled. And then they would have meetings where they would all come together, all the children's librarians would come together and actually assemble their own kits. So I think they got to look at all the pieces, understand what was in it, and then take them back. And it kind of helped on both ends, both with like having the users understand the tool, but also reduced our shipping costs. And then with that, one of the things that kind of bubbled up from this project is the importance of having some sort of introduction. So these kits are developed to be standalone products that don't require any dental expert administration. It still is helpful to have something that it is across the board, everybody's getting the same information to understand like what it is and how we suggest you use it. So there's no misinterpretation. And so we've been really happy with these brief webinars that we've created. An evaluator at heart, I come from an evaluation background. Evaluation is throughout this entire process, but I always do follow-up surveys I usually aim for about 6 months after implementation, just to get a sense of how it's actually going. And then using that information not only to make adaptations to the current kit that's being implemented, but also to determine if there are new stakeholders or content areas that you could take this tool into. And that's kind of where this started as a library project. It was grant funded. And I'll move on to that slide, kind of talking about the first project with libraries. You know, that's all I thought it was going to be. And from our feedback from the librarians, which was incredibly positive, we had 79% of librarians reporting using the kits within the first year and 84% planning to use it. And we distributed these kits to 98.4% of libraries across the state. So it was a very wide distribution. But what came out of this was that they were really hitting the 3 to 5 age group pretty solidly. But we wanted to reach 0 to 2. And then this idea of trying to work more with pregnant women came up. And so that lent itself to the next adaptation, which was for home visitors. We're able to take those larger library-based kits, working in partnership with home visitors, break them down into something that was more travel-friendly, a little more cost-effective, and included more detailed health information, given the home visitors had more kind of expertise and were more comfortable with the more in-depth health conversations. So that's where that InfoBites tool came from. And then we have now started working on another adaptation of this for early learning. So I'm going to wrap up. I know I'm taking too much time. But so we're now in the middle of a pilot with Berks County to develop these, to kind of take, it's almost like a hybrid model between the library kits and the home visitor kits to create story kits for early learning. And I'm so frustrated that we weren't a little bit ahead of the curve with timing, because I feel like this type of educational material in early learning settings, I mean, across all settings, is going to be so important, given you know, the public health crisis that we're all in and the access issues we're all going to be encountering in the future. But I feel like with early learning, it's sitting there and it's a prototype, but I wouldn't want to push it out until we were able to do our pilot, and our pilot can't move forward until we're back and open operating and childcare centers. So I'm hoping that maybe we can catch up quickly and get some of those tools turned around. But in the meantime, the library kits and the home visitor kits are finalized and ready to go. And then I'm also working to develop with the chapter. I'm one of 8 programs at the Pennsylvania chapter of the American Academy of Pediatrics. And we're looking to kind of take this concept of story kits and adapt it for different content areas, as it has been so well received. Yeah, and I just want to continue to share and get this type of information out there. And I encourage everyone to reach out to those, you know, maybe not typical community stakeholders, because every group I've worked with has been very eager for this information, very easy to work with, and very happy to get that guidance around oral health, where I think a lot of people aren't quite sure what to do or what to say, and convincing them that it's you don't have to be an expert. So I'll end with that. So thank you, Helen, for giving me the opportunity to share. I'll turn the thing back over. If anyone has any questions, I'm happy to answer them, or if we want to follow up later on, knowing we have others to share.
Any questions right now for Kristen? Okay, I think many of us know your work well, Kristen. So
yeah, like preaching to the choir.
And I would love to ask Katy if you want to share a little bit about what your work is doing now, just in terms of community work and what's going on. So Katy Hartman is here. I know you unmuted yourself, so let's try it out.
I'm ready. Well, hello. I do recognize a lot of your names and faces as well. So yes, I work for Adagio Health, and the program that I manage is Tobacco Free Southwest, and we do tobacco prevention and control for the Southwest region of Pennsylvania, which covers, you know, Beaver, Butler, Armstrong, Indiana, down all the way to Greene, Somerset, Cambria, all the way around, you know, the good 10 counties in the South. And we are trying, you know, obviously to do everything that we can during this pandemic. I'm sure you've seen you know, a lot of the studies out there that show that people who smoke are, you know, more likely to have severe symptoms from COVID, you know, compared to those who do not smoke. You know, so we're doing our best to, you know, stay relevant and do what we can to stay out there for, you know, our clients and our patients, you know, because it's still essential to keep our services out there. So we have switched our classes to virtual classes. Oh, I was going to share my screen with you guys. I'll keep talking while I do it. But, so we did switch our classes to virtual classes. So our website is tobaccofreesouthwest.org, and you can go to the classes /virtual-classes. And it has all the information about, you know, the classes, the curriculum that we use Smoke Free for Life. And then it has where they can register, you know, just put in your name, email, phone number. And it also has our Adagio Health phone number, excuse me. And then if they just want to go directly to the quit line, there's a link to the quit line as well. So people can go ahead and just register there. And we do have social media ads going out there, and we have created flyers that we're sending out to food banks and stuff like that. You know, so if anyone, you know, wanted flyers that you wanted to pass around, you know, we'd be more than happy to send that to you. So we are doing that right now. And we have launched a QuitLogix virtual training. So, you know, a lot of providers have been busy right now, but they still want to make some referrals to the quit line for their clients, you know, that might be smoking right now. And obviously, you know, we usually go around to medical offices and train them in person. But again, they're very busy right now, but they can take this training. It's just on YouTube. It's like 7 minutes. So whenever they have free time, even if they're home, they can just go through. All they have to do is go to southwest.org again, /registration, complete the registration. And as soon as they submit it, it redirects them right to our YouTube page where they can watch the video. And then again, there's another link to QuitLogix. If they just, you know, click here, it just directs them directly to the QuitLogix site. So yeah, so we have that updated on our webpage now for everybody. Just, you know, something convenient in this time. How do I, oh, stop share. Something convenient in this time, just to, you know, help everybody. You know, hopefully it's helpful. We do what we can. And then another thing that we're doing in our region, we do a lot of experts trainings, and they did come out with an expert training specifically for oral healthcare providers. The CDC, SAMHSA, and NIH do want to integrate substance abuse and assessment into general healthcare altogether. So they did come out with some special trainings specifically for oral healthcare professionals. So I just wanted to let you guys know that. So if you have an interest for your specific, you know, agency, or, you know, whoever you work for, or if you know oral healthcare providers that might want that specific training on experts for oral healthcare providers, you can reach out to me. You can throw me an email or give me a phone call. And we have someone, you know, at Adagio Health that can do that training for you now. So just throwing that out there as well. So just a little quick update on us. That's it.
Great, thanks, Katie. And Paula, well, first of all, does anyone have any questions for Katie? All right, if not, Paula, would you mind sharing next?
Hi, can everyone hear me okay? Okay. Well, my name is Paula D Gregory, and I am a certified tobacco treatment specialist, and I work with Northwest PA Tobacco Control Program. And we provide similar services in the Northwest area that Katie just was discussing that she provides in her region. And we have 13 counties in the Northwest, from Clarion to Mercer, Lawrence, all those communities. So similar, if you're in those areas, you can reach out for the similar services. But today I was going to talk specifically with you about something that we partnered with the PCOH. Well, just a little bit of background on me. As I said, I work in tobacco, and I'm a tobacco programs facilitator, and I've been providing prevention and cessation programming for almost 10 years now. Kind of hard to believe. Part of what we do, as Katie said, is that we bring training to healthcare providers, because we know that healthcare providers are on the front line, and we know that what you say to your patients matters in terms of cessation, in terms of helping them feel motivated to quit, and also keeping them abstained from smoking if they do quit. So to that end, we've developed training module. It's a two-part training module that we're hoping to introduce in January that's going to be worth 2 CEU credits. And the first part of it will incorporate, I'm going to share my screen with you. We'll incorporate Live Healthy PA and, from the Pennsylvania Department of Health Partnership and Department of Pennsylvania Health Services. And it's every smoker, every time training that will ask participants to sort of take on their own 45-minute module, and then we'll link up to a very focused oral health piece that will be the second, and we're going to host that as a live webinar on PCOH. And the idea is to integrate more of give you more resources and materials to help you in your oral health profession. So every smoker, every time is presented from all healthcare professionals. And so then we wanted to take a step further by offering integrated nicotine dependence with oral health training webinar to sort of bring it home and give you, like I said, the justification and connect it to what you're seeing on the front line, because you guys are seeing the effects of negative outcomes for tobacco and nicotine use and vaping and all those tobacco products and smokeless tobacco. So the second part of the training will give you those, make those connectors for you, and sort of and give you strategies on how to have those discussions with your patients to sort of encourage them to take the next step and make a quit, because we know, again, that you guys are on the front line and what you say matters, and we know that these negative outcomes also lead to the most preventable cause of death in the United States. So you, it's giving you that reinforcement and encouragement to integrate cessation counseling into your office system to the degree that you're comfortable with. We'll provide you, like I said, strategies to do counseling and or just give you resources so you can make referrals. And one of the biggest reasons that we decided to push forward with this is that we are now, there's a new coding allowed for billing tobacco services. So, and that's going to be part of the second part of the training, is to show you how to bill for that and get you connected to that resource as well. So we're excited, and thank you, Helen and PCOH. We've been talking about, we've developed partnership and been in conversation for a while, and I'm just excited. I've been so impressed, and I love this organization and their competency and reach and support. So I'm pretty excited to be able to partner with them to get this training out there.
Thank you, Paula.
Paula, I'm super excited about this. I really like that. I'm wondering, I feel like we should, or you should make like a brochure size thing, because you know how we go around and take like those rack card displays? We could put them in there. You know what I mean? Because they're like 3-tier. To oral, like to dentists, because we usually take them to like other healthcare providers, but if we take them to dentists with like the quit line stuff, we could take like it could be one of the things. I don't know, that might not make sense. I'm just like thinking, how do we, and you want the dental assistants to take this, right? Or do you want the actual dentist to take it?
Everyone. Well, I believe the dentist, in order to make it the most effective, we'd like the dentist, everybody to take it, so that they would have those strategies. So that everybody, I mean, yeah, optimally the dentist and anybody in the staff that has contact with the patient, because the dentist has that opportunity, you know, it's a captive audience. You can have that conversation, you know, and just sort of integrate it. And plus then if it's the more touch you have on that, right? We know that if the dentist talked to you about it, and then as you're, you know, well, as your intake, when you meet the hygienist, they ask you about it, and then the dentist can carry on the conversation, then that's even better. And I believe for billing purposes, that would be the best way to go as well.
That's fantastic, Paula. That's great. Good work.
Oh, thank you. I'm having such a hard time figuring out how to not share my screen anymore.
We can take it back.
Oh, I see it now. I see it now. Okay, thank you.
And just, I know we have some managed care organizations on the call. We've got FQHCs on the call. So, you know, if these groups are, you know, interested in promoting this, we should have some more definitive information over the next 2 weeks or so. Just to clarify, I think the website showed that the June is our start time. That's when we want to have the first live webinar. But it's going to be housed on PCOH's website for a long time. So it's something that can be an ongoing recommendation for dental providers. And I also want to clarify that it's going to be 2 credits, not 3. So our 3 credit was more for in-person when we were going to be doing some other things. So we do have to update that, but it's pretty exciting, and we're really excited about the opportunity to really bring tobacco cessation into the dental office, especially as a reimbursable service. It's just great. So, you know, just sort of, any comments on that? Questions, concerns? Feel free to unmute yourselves. I'm promising we won't mute you unless you have children screaming in the background.
I just need to remember to keep muting myself again.
I believe anyone on the phone can also unmute yourself, so that, you know, if you would like to, what is that? They have to say *6, Amy? Is that how it works?
I believe so, yes.
So I'd like to, am I double unmuted? Yeah, so
Yes.
I would just like to emphasize that, you know, this is a 2-part training, right? So the every smoker, every time is prerequisite to the customized dental provider training that Paula will provide. And I just wanted to really emphasize how important that second piece is, because it really does customize for your situation and the things that'll resonate with your patients. And also tobacco products are changing so frequently, right? There's all the, you know, this different smokeless products and vaping, and, you know, information is evolving so quickly. That second part, I think, is really, really important to take.
Thank you. Yeah, thank you. Yeah, that yeah, of course I think so too.
Does that second part like connect them to you at all, Paula? Like, do you get like a notification? That's good.
Oh, you mean that? I'm sorry.
We'll be
The second.
tracking.
Yes.
We'll be tracking it. Yes, absolutely.
And we're also going to be linking people to the PA for Quit line. Like that's part of the resources you were talking about. So, and you know, real strategies on how to integrate it like as seamlessly as they can. Suggestions on how to do that into their practice. Who the appropriate people might be to do that. Yeah, and we'll be giving them the resources regional, like statewide, who to contact. You know, a lot of the things that every smoker, every time, those elements, but again, as Mary Lynn said, connecting it, making it specific to the dental oral world, and your office situation, and just, you know, giving you the resources and the guns to feel like this is something that you can have a conversation about, so you feel informed and educated about, you know, coming from the oral health world.
Great. Yeah. So often they don't connect oral health and tobacco use. I mean, so often.
Yeah. You mean like the patient, right? And we assume that they do, right? Because we're in this world, and we, but so those conversations and how to have them in a non-confrontational way, and because that can be a tricky thing, and but it's just like, again, getting knowing what the resources are, what the facts are, and getting the education behind you to make you feel comfortable to have those discussions.
Awesome.
Yeah. Anybody else want to give an update on sort of your organization or your individual work, community outreach?